Hi there, my name is Iacovos Michael. I'm a postdoc fellow working in the lab of Dr. here at the Samuel Lunenfeld Research Institute. So during my project, the aim of my project is to develop new drugs which belong in the group of biologics, which is basically recombinant proteins which we can produce using basic recombinant techniques. So based on my background in the pharmacy degree I had, I always found it very fascinating and exciting to be able to translate and research how we can develop new drugs in the lab area. So if you think about cancer therapy, the traditional way to treat cancer, it would be surgery. So with that way you can remove the whole cancer. Or even with radiation or chemotherapy, what we do is that we are able to attack the cancer as a whole. Recently, with the new knowledge, we are moving into a more personalized way. So we're trying to target different pathways that are involved in doing cancer progression, like, for example, pathways involving proliferation. However, by doing this, for example, by using antibodies that are very specific for only one pathway, we're giving the chance to the cancer, because it's heterogeneous, to select for the population that is not targeted. So then at the end we have a recurrence of cancer. The ideal way would be to use different combinations of antibodies so that you will be able to target different pathways at the same time. So one of the pathways that are involved in cancer progression is angiogenesis. So you have the development of new vessels, which are very important during cancer progression, both for nourishment of cancer, and also they have an important role later on for metastasis. One of the factors that is upregulated during angiogenesis is the vascular endothelial growth factor, or VEGF. So VEGF is very important for both proliferation and migration of vessels. And research that was done 15 years ago here in the lab of Dr. showed that this factor is absolutely necessary for the development of new vessels. So if there is a way to completely take out this factor from the tumor microenvironment, then you won't have any vessels. So in theory, by doing this, the tumor will stay dormant, and at the end will relapse and will die. So here in the lab, we're trying to produce two different classes of anti-angiogenics. The first one we call it VEGF sticky trap, and the second one VEGF lasso. The reason is that VEGF, as I said, is very important not only for cancer, but also it's very important for maintaining the normal physiology of the human body. So by giving antibodies that basically neutralize VEGF in the body, and then you might have some side effects. So with this rationale, we wanted to develop something that will be absolutely specific for cancer. So what we did, basically, we developed a new bifunctional antibody that can bind to vascular endothelial growth factor and also into the microenvironment, the extracellular matrix of the tumor. So if you have a way to deliver this molecule now into the tumor site, we were able to show that it will stay there, and so it will cause regression of tumor development, but then at the same time you will avoid any of the side effects. Now the second class, VEGF lassos, it has a little bit different aspect. It's also a bifunctional molecule, but then the idea there is that now we'll be able to target two different pathways which are important during tumor progression. Again, the first pathway is angiogenesis, so we're targeting the vascular endothelial growth factor, and the second pathway is involved in during cancer proliferation. So as a proof of principle, we're targeting the HER2, which is a receptor that is amplified, for example, during breast cancer in humans. So since we've done these two new classes of biologics now, we will have the next challenge, which is in the case of VEGF sticky traps, to find ways to deliver them into the tumor site. So now we're going to incorporate a cell-based method that will allow us to deliver VEGF sticky traps into the tumor site. Regarding the second molecule, the second group, VEGF lasso, since we have the proof of principle with HER2, now we're moving into new pathways or new factors that are also involved during cancer progression. For example, other factors that are important for angiogenesis. So by this way, we're trying to target different pathways by using these bifunctional biologics. The role of donors, it's very important, and I was a veteran fellow last year, and I think it's twofold. The first thing, I think it's very important for us as a scientist to be able to communicate the research, basic research that happens here in the lab, and how we can translate this into medicine, into the hospital, in the clinic. So I think it's very important for people who donate money to be able to understand this and appreciate what's going on in the lab environment. The second very important aspect of donors, of course, is that they can facilitate by giving money to build new facilities like the one that we're right here, that will allow us to improve the research and accelerate the research at Mount Sinai Hospital.